Hello, everyone, and welcome back to Mic Check
2.
My name is Rachel.
I'm Aja.
I'm Sean.
And today we're joined by two lovely guests. I will allow them to introduce themselves.
Hi, everyone. My name is Judith Moore. I work at St. Hope as a sonographer. I started in 2023. For those of you that don't know what sonographer is, it's an ultrasound technologist.
Fancy.
Nice.
And I'm Juana Beltran, and I've been working for St. Hope since 2022. I'm a rad tech. I do x-ray, mammo, and DEXA scans.
Got a whole list of services.
We do, and it seems like they're both familiar with imaging, and that actually leads us to what the topic of this episode is. Since it is Breast Cancer Awareness Month, we do want to talk about a new service St. Hope is going to be rolling out, and it's dealing with ultrasounds. So
so as Sean mentioned, it is breast cancer awareness, and we all know how important it is, especially to get these examinations. And a lot of times people don't know what actually happens in these exams, and it kind of deters them from coming. So we have these ladies here. Some of y'all can give us a little insight what to kind of expect if you're coming in for a breast examination. So would it be on ultrasound, or would it be with the radiologist?
It will be with me first.
Okay, first.
In the mammography department. Yes.
Okay.
well, let's start. What is an ultrasound?
Well, that's back to her then. Okay.
This is all you right now.
Yes. So an ultrasound is basically an exam that is performed without radiation. Typically, it uses sound waves to create an image, and then those images are read by a radiologist.
And what would it detect for?
It detects anything from fluid, masses, tumors, cysts, calcifications, anything inside the body. It can pick up blood flow and just any kind of abnormalities inside the body.
Okay. So it starts here first because yours is a more detailed exam.
Well, when it comes to anything abnormal with the breast, I will perform the mammogram screening first.
Okay. So what happens during that screening?
So during that screening, at the beginning, I will have to talk to the patient over the phone to see when she can come in. And it's recommended for her to come in when her breasts are not as tender. So that will be 2 weeks after their period or menstrual period. After that, I will ask if this will be their first mammo or will be something that she has been doing lately. And she will let me know yes or no. And then from there, I will give her instructions not to use any deodorant, not to use any lotions, and to pick a time where both of us can actually meet, right? So she will come in, and it will take like a 30-minute process. Just because I like to make them feel comfortable because they're terrified of the compression paddle. That's like the biggest fear in mammography, which is really not.
So what's the
So compression paddle is pretty much like a
compression paddle is the machine.
Okay.
Yes.
the little tunnel they go in?
No.
Is it a tunnel?
It's a detector where I place the
right.
breast and a compression paddle comes down.
Okay.
Oh, okay.
I think you're talking about CT, my girl.
Yeah.
okay.
Yeah, CT is the tube.
Yeah.
Okay, you're right.
Y'all know I had one for my ankle, so I know.
Okay, so the compression paddle comes down, and
So there's 4 views in mammo.
Okay.
There's bilateral on each and also bilateral medial oblique. So I have them like in an angle. Both of them need compression. And the standard compression is at least 10 pounds on each breast.
So you have 10 pounds pressing
on the breast.
Okay.
Now, I am very patient. I talk through it, especially if they're nervous. They tend to move because they want to help me out. But that's not necessarily the case. They need to be still, and for me to anchor the breast to get a good image to the radiologist so they can perform a good diagnosis. So I lower the paddle enough for them to feel, but then everything I do by hand, slowly,
okay.
until they tell me that's enough. It has to be taut. It doesn't have to be all compressed, but it has to be enough compression.
And that's so the compression is to get a good image?
To spread out
Okay.
the tissue.
Okay. Makes sense.
Yes. And I expose, which is like 2 to 3 seconds, and it'll raise up automatically. It will release.
And that's it.
That's it for one. And
Okay,
I gotta
you
do
do
the
the
other.
other.
I
What
gotta
you
do
do
the
to
other
one, you
one.
gotta do to the other.
Correct.
Okay.
And then there's the angle view on both. So we perform 2D and 3D all at once.
Oh, okay.
Nice. So I guess my question is, so let's say you you do your performance and you find something. Is that then when they would go to ultrasound? Maybe like later on when they're in had treatment already, then they get ultrasounds for the breast exam, or
Typically, what'll happen is the physician or the reading radiologist will recommend an ultrasound depending on what the results were from the mammogram. So if they've had like abnormal findings or if they had really dense breast tissue, then they'll order an ultrasound for the patient.
okay, so it's even before treatment starts.
Right.
Oh, okay. Fun fact, I didn't know that.
Me neither.
Yeah, so thank you.
Yeah, so that's why that a mammogram is pretty much the first step to getting screened for breast cancer.
And then typically that's done. Well, it's not done, but when you go for ladies, if you go in for your well woman exam, I know at least for my location, I know the providers will order the mammogram typically during the well woman exam. That's when they'll do the follow up and schedule the appointment to do the mammogram first. And then if something's wrong, they go into the ultrasound step.
Correct.
Okay.
Yes.
And I know y'all keep mentioning ladies, but is it just, this is not just something that happens with women, correct?
No, breast cancer can actually happen in both sexes. So men can also suffer from breast cancer depending on if you have a family history, if your maternal side had any kind of breast cancer genes or anything like that, then it can also affect men.
So men should possibly get mammograms too.
Not necessarily a mammogram. It's kind of difficult to do a mammogram on a man, especially if they don't have enough
Dispelling
tissue.
myths here.
Right.
I mean, I have seen where some of the orders have come through for male patients to have a mammogram, but then if they don't have any tissue, how can the machine compress on their
You're
breast?
just pressing on like chest.
Right.
So then they would get an
So then
ultrasound
in that
instead.
instance, the provider might order an ultrasound just to kind of check out what's going on.
Okay.
Oh, nice. So during men examinations, are they checking, or how would they? Is it just based off family history? I guess.
I think based off of family history and symptoms.
Yeah, 'cause
But
I've never had that. I've had. I was just like, because I when I do my physical, that's never been. I always do. They always. For me, the doctor will be like, do the cough thing. For guys, you know what I mean when they say
Yes.
Yeah.
do the cough. But I've never had a doctor.
Maybe because it's probably not family.
it's not
history.
as common.
Yeah.
So breast cancer in men is actually it makes up 1% of cancers. So it's not that common. It's kind of rare for a man to have breast cancer, but it
still
can
happens.
happen.
It can't happen. Okay.
Yeah.
Okay. Well, that makes sense, because you would think like, oh, a man's just gonna get a mammogram, but now that you know what a mammogram is, it's not happening. They gotta
Sorry,
go to
fellas.
the ultrasound.
So how often when we're doing? I know women go in for their well woman exams at least once a year. Should they always do a mammogram every single time, or?
It's only doctor's orders.
Or when should you start doing mammograms?
So I try my best to schedule the patient when they get their pap smear or their woman exam with me as well, so they can just get everything done.
Okay.
Needed. So there's 3 different categories. A woman that is low risk of cancer, meaning that they don't have any family history or they don't have any concerns or symptoms, we want them to start at age 40
Okay.
to get there first. The second category will be a high-risk person, a high-risk female or male, that would have family history, or she's having some kind of lump, some kind of discomfort, some kind of discharge. So we want her to come in and get it at 40, even before, if necessary.
40 is like a good median.
And the third one would be high-risk breast cancer survivor that has been doing any other images like MRIs or diagnostic or ultrasound. We want her to come faithfully every time after 40, every year after 40, basically.
Okay. So 40 is a good year mark. So I have a question. I know you mentioned that you do DEXA scans as well. What is a DEXA scan and what is that used to detect?
DEXA scans are to measure the density of our bones.
Okay, it's the bone
At a
test.
certain age, the consideration is 50 years and older. But it is for the density. So it would prevent or aware the patient if they have any osteoporosis to be careful not to fall because they will be easier to fracture.
Your bone. Did you
Now-
ever do a DEXA scan? For your ankle?
Now, does that come from the doctor, or is that something that?
With the doctor.
Oh, okay. So the doctor
Yes.
did the
The
orders. for
doctor
that.
will recommend.
Okay.
Anything with radiology, we need orders.
Yes.
So I guess that brings me to my next question. Do you have to be a St. Hope patient then to get these services that you ladies are providing?
Absolutely not.
Oh, nice.
Anyone can come in and get these services. As of right now, we are working to try and get credentialing done for patients to be able to utilize their private health insurance. But if they don't have private insurance at this time, we do have affordable fees for them to come in and get these services done.
And all they would have to do is just bring in an order from
Bring
the
in an
doctor.
order.
Yes.
It has to be within a year of the
Okay,
order.
so within a year,
With
you have-
me, I don't know with you, Judith.
I would say that that's about accurate.
So about it. So as long as it's within a year of their physical, they get the imaging, they can call in, schedule a brand new appointment as a new patient. Okay.
So with the ultrasound, Judith, tell us a little bit about what we can expect whenever we come in for one.
Well, for breast ultrasound or for any kind of ultrasound?
Breast, is it the same thing? Is it like no deodorant, no oils, no lotions or anything like that? Or?
So for mine, I think my patients will love me because there are no really restrictions on anything for breast
We can use
ultrasound.
deodorant in the morning.
Yes, you can use
Okay.
deodorant in the morning. Please. Now, I will say that when I do the breast ultrasounds, I would say for the patient to pack like their deodorant in their bag or in their car. That way they can reapply it because when I do the ultrasounds, I don't just examine the breast. I also examine the axillary area under the arm.
Okay.
And that area is prone to having like swollen lymph nodes, some kind of swelling. And so that's why we take a look at that area as well.
So what is the reason for the no deodorant and lotion?
Some deodorants contain aluminum. And when you do the x-ray or when I radiate this section, it'll come up as calcifications. It'll show up.
Oh.
So it may look like there's like some
There's
kind of
something on there.
abnormalities, and it's just deodorant.
Yes.
It's false positive.
So have you experienced that?
Not yet.
Okay. Everybody knows.
Everybody
how to-
follow the directions. Okay.
So we need one random person to come in with a whole armful of deodorant, just so you could be like, oh my god, what do I do?
Will you tell them like we have to reschedule? Like because I don't know about y'all, but me and my deodorant, it says invisible, but you can see mine.
So if somebody does wear deodorant, like can they go in the bathroom and wash it off, or
Correct.
is that okay?
Okay.
Yes, and I also have wipes for them.
Oh, she's so prepared.
I love it. I'm prepared.
Professional.
Look, when I turn 40, I'm gonna have to come see Juana. So I could.
So I know you mentioned radiology for the mammograms. Is it like a high exposure or is it like very minimal?
It's a very low dose, especially with the modern technology that we have now. It's about like a 0.4 millisieverts, which is actually the same amount of a regular natural radiation that we get over 7 weeks or so. So it's very low, but it is very important that we communicate with the patient. Instructions are very important because radiation safety is number one with us, with me. And just because ultrasound doesn't use radiation, we practice radiation safety every day. Every time I have a patient, I practice it. Make sure that if the patient moves, we start all over again.
You're like, not on my watch.
Before I expose.
Right.
This is before I expose. If I see that I don't have her in a good position, again. If I tell her don't move, but she kind of moves, again.
So
before I expose.
Oh.
You know, I love that Juana just keeps a smile on her face. She's just like, oh, again.
Yeah.
Yes.
One more time.
And
One more
I
time.
let them know. I try to make them as comfortable as possible. I ask them questions, natural conversations, and I tell them just lean like you're gonna faint, but you're not. And they like that. And I like try not to move your shoulder. That's the goal here. Try not to move. But if they move, I start all over again before I expose.
I love that though. Just because as women, y'all know we got some exams that can be
Uncomfortable.
yes. And so when somebody is making you feel comfortable and taking it slow, I really do appreciate that because I didn't have some people I've been like, oh, I'm never going back. I'm never going back. I'm never going back.
So, who wouldn't be a good candidate for the screening?
Somebody that's pregnant, somebody that has high risk cancer that automatically goes with either breast ultrasound or MRI. And it just depends. Like for a pregnant person, there are breastfeeding maybe, or they may be breastfeeding. The tissue of our breast becomes more dense and is not, the radiologist won't be able to read it. As much as somebody that wouldn't be pregnant.
So, a pregnant woman would be going to do the ultrasound.
Yes.
With Judith, yes.
So, if they're breastfeeding, would y'all recommend like stop breastfeeding before they get the exam, or they could still do an ultrasound?
That would be up to their physician,
Okay.
Depending on how much milk they're producing. Sometimes the ducts can actually have a cyst or something come up, and that could mimic something that could be benign or malignant. So that would just be a call from their
doctor.
provider.
Yeah, that makes sense.
So do you know the difference between diagnostic mammograms and screenings?
Yes, ma'am.
Okay.
So the screenings are the golden standard for any clinic might have screenings. And that's just a normal 4 views of the breast that we can detect before symptoms occur sometimes.
Okay.
But that's all we can do. 4 screenings, 4 views, basically. After that, if something comes back abnormal, we would proceed to either ultrasound or diagnostic, depends on the doctor.
So the screenings are more like preventative care? Okay.
And the diagnostic is more deeply in depth of anatomy, depending where the concern is. So we have magnification equipment that comes with the mammography machine where the doctor is present. So if the doctor says there's something going on the left under the nipple area, we literally bring that breast in and focus only on that area. They're called spot views.
Oh, wow.
So we can view that spot only. And if the radiologist is present, they'll let us know, do another angle, or etc. So it's more views, more deeply
More
detailed.
Okay. Now, have there ever been times when an image, how do I say it? Has there ever been a time when an image can't be used? Like how does that work? Or
If it's not, what? Like if it's not clear enough?
yeah, if it's not
or-
clear, do we just start over from scratch, or do you just throw those out?
No, we never throw those out.
It's like that's part of your record.
It's part of the records.
So
No deleting.
Oh, okay.
So I guess I'm curious about like a false positive. So
Yeah,
I guess that's kind of where you were going. So if it does come back to be like a false positive, let's say you do the screening, it may have been deodorant that we missed to wipe off or something. Do you still get an ultrasound, or can the doctor pretty much kind of tell?
Yes.
Yeah,
we
that
do
would-
further imaging until there's no doubts.
Yeah,
okay.
Like
at that
radiology.
point, that
Thank
would
you.
be where the doctor would say, "Hey, this was abnormal. I don't know why it was abnormal, but it was abnormal. So let's order an ultrasound." And then, just so y'all know, with the dense breast tissue, they can see that there's something there, but they can't really make out what it is.
Okay.
And then once they send them to ultrasound, we can make out what was in that dense breast tissue. So if there was a cyst, it's only fluid filled. Most of the time, those are benign. If it's malignant, it's a mass, and so we can show the different characteristics of that mass. Does it have vascularity in it? Is it irregular shaped? the only thing that mammo can see is that it's dense breast tissue.
Dense.
And so they'll pick up that side of it. But then once we see it in ultrasound, we can kind of paint a more detailed picture in depth and show the radiologist, was it a lymph node? If it was a swollen lymph node, then, they can see the difference between a lymph node cyst and a mass. So
let's say somebody was unfortunately diagnosed with breast cancer and they completed their treatment. They're now cancer free. Do they still have to do like yearly exams?
Depending, most of the time I've seen where they do, once their treatment is complete, they typically send them in for a 6-month follow-up. Right?
Okay.
And then they, after a certain amount of time or years, then they'll probably
Tailor
send
it
them
off.
over to like a yearly follow-up just to kind of get that screening done to catch any changes or, any new pathology that may come up.
And that would be completed by ultrasound?
Yes.
Instead of, okay.
And with the mammogram, in tandem with the mammogram, depending if it was a cancer diagnosis, depending on what stage it was, they'll use like a grading system called BIRADS, and so they'll like give it a score from 0 to 6.
Gotcha.
And depending on that BIRADS score, then they'll make their assessment and they'll make their recommendation for follow-ups.
Yes.
So how long does the breast ultrasound usually take? Is it?
That is a good question. So depending, everyone's anatomy is different. Women have different shapes, different amount of breast tissue. So if it's a small, young female and she doesn't have very big breast tissue, then that could take about 30 minutes to 40 minutes. And if it's someone that has bigger breast tissue, then that can take up to an hour. Yeah.
Well, we love to be detailed. You need to take an hour. Take your time. That's
Okay,
me.
take your time.
Take your time on me for sure.
So does breast implants or anything like that, like if you have those, will that affect, like you can still get your mammogram or
Does
it
that
get in
show
the
up
way?
weird? Does that show up like weird?
No.
Yes, his face. That is a good question though, because you
Because the
Yeah,
implant
like the
is like
silicone of
the
it.
silicone is like a silicone sac that doesn't.
It'll look white.
okay.
It'll show the implant. So instead of 4 images that I would do, it will be 8.
Oh.
Because I would take the breast with the implant, not a lot of compression this time. I will take 1, 2, and then the side views. So that's 4. And then I manipulate the implant from the nipple all the way back to push it back and get just the tissue.
And it's important for ladies to disclaimer that beforehand, like I do have.
That will be
implant.
nice.
Yes.
So don't just for ladies.
Preferred.
So would you
Well,
say it's more painful, I guess, if you have an implant?
No,
Not
well,
pain.
I haven't heard anything about pain, but I give them a questionnaire, and on the questionnaire, it'll ask, "Do you have implants?"
Oh, okay.
And some people be like, "No, I don't have implant." And they get in there. Oh, I just got it. I went to Dr. Miami last week.
Last week.
Yeah, getting the breast. No, I don't think it works that fast.
Okay, maybe not that fast.
Okay, but that's important to know
Yes.
because some people think like, oh, maybe because I have breast implants that like I
You
can't
just
get the
hear
exam.
compression, and I'll be like, "Wait, what a minute! I paid good money."
Yeah, I paid top dollar for these. So what's happening? So it's good to know that they can still get this service and it not be like a discomfort higher than a
It
normal.
won't be affected.
So
Now, where do y'all do these mammograms and ultrasounds? Out of which locations? Is it?
So for ultrasound, we're only offering ultrasound out of the Bel Air location.
Okay.
That's the only place that we have that set up for currently at the moment.
Northwest, the DEXA and the Mammo.
Okay.
But I know we're probably going to expand soon because this is a very in-demand service right now.
Right.
And with the DEXA scan, it's your whole body, or is it a specific area?
We can do whole bodies.
Okay.
We can do lumbar and hip, both. We can do forearm.
Okay.
Nice.
Because I didn't know what to expect for that.
The DEXA scan. Yeah, I'm always curious about. Like, I know, like when she said it was bones, I was like, "Girl, you knew that," but it totally slipped my mind for some reason. I don't know why.
So even though the episode is catered to breast cancer, we just want to put it out there that the DEXA scan, the ultrasounds are for everything.
Whole
Right.
body.
Whole body.
Because you're not just looking for breasts, you can do
the head,
I can.
arm.
Well, head and neck is going to be like your carotid arteries, your thyroid, any kind of the glands, salivary glands. And then for like the general ultrasound, abdomen area, we do all of the internal organs like your liver, your kidneys, your spleen, your gallbladder. We check for stones. We check for pancreatitis in the pancreas. We can do urinary system. The bladder sometimes has different abnormalities. Prostate on men, we can do a pelvic prostate exam. Females, we do pelvic ultrasounds for female organs. We're working to offer more in-depth studies for that. And then we do arterial and vascular scans. So upper extremity, lower extremities, checking for like a deep vein thrombosis or any kind of arterial occlusions, things like that.
As long as y'all have an order for them, you can pretty much. Okay.
And it doesn't have to come from St. Hope. That's good.
And this is my shameless plug for Judith.
She
knows.
We love a shameless plug.
Got a little imaging done, and I was like, she made me feel comfortable. She got me together.
Yeah, I love that. But it's so interesting because a lot of times people, when they think of ultrasounds, they just automatically assume like, pregnancy.
Right.
But it's just so much more that can be done.
Right.
Yeah.
I was shocked. It was like blood flow and all this stuff. And then she was putting color on the screen. I was being nosy.
She had color on the screen.
Yeah, look, color pop up. I was like...
The Doppler.
Yeah. Y'all fancy over there saying
my neck was like this.
What you doing over there?
What you see?
But just to tie it back to breast cancer, because here at St. Hope, we do think it is very important, and we want to offer these services, of course, at a very affordable rate. And we're also offering a promotion starting Monday, and we're going to run that up until November 4th for the mammogram service along with their DEXA scan services. So for more information, check out our social media because we'll definitely post that information there.
So I am so appreciative for you ladies coming and giving us all this information. I'm sure it's something that we missed. So is there anything that you would like to let our viewers and listeners know?
Just to be your own advocate, females, women, young women that are still experiencing menstruation, make sure that you do your own self-exams, your self-breast exams every month. Try to make sure to remember that because you are your first advocate for yourself. So typically, you'll just do an exam maybe about 3 or 5 days after your period ends. Mm-hmm. And then just make sure that you check for lumps, any skin changes, if there's itching, redness, any nipple discharge, any kind of lumps, even under your arm. That way you can let your doctor know that, hey, I need to get this checked out. Because that's the first step. You don't have to wait until you're 40 years old to get a mammogram. So if you feel something that's abnormal or see something that's abnormal, let them know. That way you can get your foot in the door and get that screening done for yourself. And then for men also, make sure that you check yourself out as well every month. You don't have to have a menstrual cycle to check yourself. But, men can have a nipple discharge. It can be clear, it can be bloody. You can have spots, you can have itching, you can have lumps under your arm, around your breast area. And the most common spot for men to have a lump is going to be right behind the nipple. So if your nipple has any changes, any color changes, make sure you tell your doctor about those changes. It's not something that you should just brush off because, it can affect men as well.
And knowing your family history, that's very important. Yes. Yeah. Anything, Juana?
Same, especially with mammograms. Density is a big, big thing. It has become a law in Texas that we do have to let the patient know that they do have dense breast tissue. Mm-hmm. That being said, they need to get further imaging. That's very important because if they don't get the further imaging, the radiologist might not see something. And it's very important to get that further imaging.
So now that you ladies are in the service, are y'all telling all your family get your breast exams?
Yes.
It's you're sending your reminders happy 40th birthday. Did you know
it's time for you to get your mammogram done. When was the last time you had a breast screening done?
I always think it's so interesting when people are actually in the field, they're always very pushy and advocating.
Sometimes you need that though.
Yeah, for sure. Absolutely.
Yes.
But I just said, we really enjoyed having you ladies on, and
Thank you for inviting us.
Personally learned a lot about some services that we offer here. You feel touched, John?
I did.
You going to do your self-exam?
I'm going to do my self-exam. Look for any kind of discharge.
And stuff. Yeah. It's very important, though, because a lot of times, even though it's only 1%, it can still happen. So.
And there's a condition that men suffer from as well called gynecomastia, and that's enlargement of the breast. It's a benign condition, but it can also mimic some of the characteristics of breast cancer symptoms. So that's a good thing.
So that's something that we can ask for during our physicals. So thank you, ladies, again for coming. We do genuinely appreciate your time. If you are interested in any kind of imaging work, whether it be a mammogram, whether it be an ultrasound, you can call in at 713-778-1300, or you can use our chat feature on offeringhope.org. Just make sure you have an order from a provider, and we'll be able to get you scheduled right away. And just remember, here at St. Hope Healthcare, you're more than just a number.